Who should use the FRAX tool for osteoporosis? Have you ever wondered who should really be using the FRAX tool for osteoporosis? This tool is a valuable resource for healthcare providers. It helps estimate a person's 10-year risk of hip or major osteoporotic fractures. So, who exactly should consider using it? First and foremost, the FRAX tool is most appropriate for postmenopausal women and men aged 50 and older. These groups are at a higher risk for osteoporosis-related fractures. If you fall into this age category, it is worth discussing the FRAX tool with your healthcare provider. Next, individuals with low bone density, also known as osteopenia, should also consider this tool. If you are not currently taking osteoporosis medication and have been diagnosed with low bone density, the FRAX tool can help assess your fracture risk. Additionally, if you have clinical risk factors for osteoporosis, the FRAX tool is beneficial. This includes having a history of fractures, a family history of osteoporosis, smoking, excessive alcohol use, or certain medical conditions like type 1 diabetes. If any of these apply to you, it may be a good idea to talk to your healthcare provider about using the FRAX tool. The FRAX tool is particularly useful for patients who may not have immediate access to a bone mineral density test, such as a dual-energy X-ray absorptiometry scan. It can provide an initial risk assessment to guide further testing or treatment decisions. The tool combines clinical risk factors with or without femoral neck bone mineral density to estimate fracture risk. This means that even if your bone mineral density is in the osteopenic range, the FRAX tool can help identify those who might benefit from osteoporosis treatment. Generally, if your 10-year hip fracture risk is 3% or more, or if your risk for a major osteoporotic fracture is 20% or more, this indicates an increased fracture risk. In such cases, it is important to consider treatment options with your healthcare provider. Screening guidelines often recommend using the FRAX tool for adults over 50, especially postmenopausal women and older men. It is also recommended for those with risk factors but without prior fractures. In summary, the FRAX tool is a valuable resource for healthcare providers assessing fracture risk in adults over 50, particularly those with risk factors or low bone density. It helps guide decisions about osteoporosis screening and treatment initiation, aligning with current guidelines aimed at preventing fractures. If you think you might benefit from the FRAX tool, consult your healthcare provider for personalized advice.